Navigating the world with level 3 autism can be incredibly challenging, both for individuals and their families. This severe form of autism requires a deep understanding and a support to help those affected lead fulfilling lives. By exploring the wide range of symptoms associated with level 3 autism, we can better appreciate their unique experiences and needs. 30 symptoms of level 3 autism. Navigating the complexities. Limited communication. Individuals with level 3 autism often struggle with both verbal and nonverbal communication, finding it difficult to express themselves and understand others. Delayed speech. Many children with level 3 autism experience significant delays in speech development or remain nonverbal throughout their lives. Repetitive behaviors. Repetitive movements such as hand flapping, rocking, or spinning are frequently observed, often serving as self-soothing mechanisms. Sensory sensitivities. Heightened sensitivities to sensory stimuli like light, sound, touch, or taste can cause extreme discomfort and distress. Self-injurious behavior. Some individuals engage in self-injurious behaviors, such as headbanging or biting, particularly when frustrated or overwhelmed. Social isolation. Difficulty in understanding social cues and building relationships can lead to social isolation and a lack of peer connections. Limited eye contact. Maintaining eye contact can be challenging, with individuals often avoiding or struggling to make eye contact during interactions. Tantrums and meltdowns. Emotional dysregulation can result in frequent tantrums and meltdowns, especially in response to sensory overload or changes in routine. Aggressive behavior. Some individuals may exhibit aggressive behaviors like hitting or biting as a way to communicate their distress or frustration. Echolalia. The repetition of words or phrases, known as echolalia, is common and can be a way of processing language. Extreme routine dependency. A rigid adherence to routines and difficulty coping with changes in schedules is a hallmark of level 3 autism. Limited interests. Individuals may exhibit intense interests in specific topics, often to the exclusion of other activities or subjects. Lack of pretend play. Imaginative or pretend play is typically underdeveloped or absent, impacting social and cognitive development. Difficulty with theory of mind. Understanding others' thoughts, emotions, and perspectives can be particularly challenging, affecting social interactions. Intellectual disability. Many individuals with level 3 autism have intellectual disabilities that affect their learning and adaptive skills. Difficulty with transitions. Moving from one activity to another can be distressing, often leading to anxiety or behavioral outbursts. Communication challenges. In addition to verbal communication difficulties, nonverbal cues such as facial expressions and body language may be hard to interpret. Limited response to social rewards. Individuals may show little interest in social interaction or the approval of others, making social motivation challenging. Gastrointestinal issues. Gastrointestinal problems like constipation or food sensitivities are more common, adding to the complexity of care. Need for specialized support. Intensive individualized support, including speech therapy, occupational therapy, and behavioral interventions, is often required to improve quality of life. Hypersensitivity to changes in environment. Even minor changes in the environment can be overwhelming and may lead to significant distress or behavioral issues. Sleep disturbances. Sleep problems, such as difficulty falling asleep or staying asleep, are common and can exacerbate other symptoms. Anxiety and phobias. High levels of anxiety and specific phobias are frequently observed, often requiring tailored therapeutic approaches. Limited play skills. Play skills are often limited, with a preference for solitary play or repetitive activities rather than interactive or imaginative play. Difficulties in daily living skills. Challenges in daily living skills, such as dressing, eating, and personal hygiene, necessitate ongoing support and intervention. Unusual eating habits. Unusual eating habits, including a preference for specific textures or resistance to trying new foods, are common. Poor motor coordination. Motor coordination difficulties, such as clumsiness or poor fine motor skills, are often present, impacting physical activities. Limited emotional regulation. Managing emotions can be particularly difficult, leading to frequent emotional outbursts or prolonged distress. Resistance to physical contact. A heightened sensitivity to touch can result in a strong aversion to physical contact, making it challenging to provide comfort or physical support. Overwhelming fear of new situations. New situations or unfamiliar environments can provoke intense fear and anxiety, often leading to avoidance behaviors. Living with level 3 autism presents a myriad of challenges, but it's important to remember that each individual is unique, with their own set of strengths and abilities. By fostering a nurturing and inclusive environment, we can help those with severe autism find their place in the world. Empathy, patience, and tailored support are key to unlocking their potential and ensuring they feel valued and understood in our society. Together, we can make a meaningful difference in their lives, celebrating their individuality and resilience.